I need to tell you about the day I thought I would die at work. The day when everything I learned in nursing school, every patient I ever cared for, every detail I ever noticed came down to one moment, one decision, one detail that everyone else missed. My name is Lauren Matthews, and I'm an emergency room nurse. What I'm about to share with you changed everything I thought I knew about courage, about medicine, and about the invisible battles some people fight every single day. This is the true story of how I saved my hospital from a trained sniper, not with force, not with negotiation, but with something far simpler, something hiding in plain sight that could have prevented a massacre. My name is Lauren Matthews, and I never imagined my life would lead me here. I grew up in a small town in rural Montana, where everyone knew everyone, and the biggest emergency was usually a tractor accident or a bad fall during hunting season. I became a nurse because my grandmother spent her final months in a hospital, and I watched how the nurses cared for her with such tenderness and skill. They weren't just medical professionals, they were angels who made her last days comfortable and dignified. I wanted to be that for someone else. After graduating from nursing school in Missoula, I moved to Seattle to work at Harborview Medical Center, one of the busiest trauma centers on the West Coast. The transition was brutal. Going from quiet Montana to a level 1 trauma center in a major city felt like being thrown into the ocean during a storm. Gunshot wounds, stabbings, car accidents, overdoses. Every shift brought something I had never seen before, but I adapted. I learned to think fast, move faster, and trust my instincts. The emergency department became my second home. I knew every corner, every supply closet, every shortcut through the halls. My coworkers became my family. We shared dark humor to cope with the darkness we witnessed. We celebrated small victories and mourned the patients we couldn't save. And we learned to recognize the regulars, the patients who came back again and again, each with their own stories, their own struggles. One of those regulars was a man named Derek Hoffman. If this story has already grabbed your attention, go ahead and subscribe to the channel now, because what comes next will surprise you even more. And Derek Hoffman was a ghost of a man. 42 years old, former Marine Corps sniper, 2 tours in Iraq, 1 in Afghanistan. He came to our psychiatric clinic every 2 weeks for therapy and medication management. I had seen him in the emergency department twice before, both times for severe hypoglycemia. He was a type 1 diabetic, diagnosed in his 20s, and managing it had become harder after his military service. PTSD, depression, and the chaos of his mind made it difficult for him to maintain his insulin regimen properly. I remember the first time I treated him. He came in confused, sweating profusely, barely able to speak. His blood sugar was dangerously low. After we stabilized him, he sat in the bed and cried, not from pain, but from shame. He told me he felt like a failure, a trained warrior who couldn't even take care of himself. I held his hand and told him that asking for help was the bravest thing a soldier could do. He looked at me with such gratitude that I made a mental note in his chart, detailed notes about his behavior during hypoglycemic episodes, his triggers, his patterns. Our emergency department ran like a well-oiled machine most days. Nurses, doctors, techs, and paramedics working in perfect synchronization. The smell of antiseptic mixed with coffee from the break room. The constant beeping of monitors. The rush of gurneys down hallways. The controlled chaos that somehow made sense to those of us who lived in it. We had protocols for everything. Active shooter drills, fire evacuations, mass casualty incidents. We trained for the worst and hoped for the best. But nothing, absolutely nothing, prepared us for what happened on that Tuesday in March. Thank you for staying with me this far. It shows you're feeling what I felt when I lived through this. So go ahead and subscribe and turn on notifications, because what comes next changes everything. It started like any other shift. I clocked in at 6 in the morning, grabbed my coffee, and received handoff from the night shift nurse. We had a full house, a motor vehicle accident victim in Bay 3, a possible stroke in Bay 7, and a young man with a stab wound waiting for surgery. Just another day in the organized chaos of emergency medicine. I was checking vitals on the stroke patient when I heard it, a sound that didn't belong, a sharp crack followed by screaming. At first I thought it was a backfiring car outside, but then I heard it again and again. Gunshots. Inside the hospital, my training kicked in immediately. I pulled the stroke patient's bed away from the door, locked the wheels, and hit the panic button on the wall. The hospital-wide alarm began blaring. Code Silver, active shooter. Within seconds, our department went from controlled chaos to absolute terror. I ran toward the nurse's station to help coordinate lockdown procedures, but I stopped dead in my tracks when I saw him, Derek Hoffman, standing in the middle of the emergency department, holding a rifle. The same rifle he probably carried overseas. His eyes were wild, unfocused, darting around the room like a trapped animal. He was soaked in sweat, his hands trembling as he pointed the weapon at anyone who moved. 7 of us were caught in the open, 2 doctors, 4 nurses including myself, and 1 medical technician. Derek screamed something incoherent current and fired a shot into the ceiling. Tiles and dust rained down on us. He ordered everyone to the ground. We complied immediately. He moved with military precision, locking the doors to the department, pushing supply carts in front of entrances, positioning himself near the window with a clear view of the parking lot. Within minutes, I could hear sirens outside. Police were already surrounding the building. Derek had just taken a hospital emergency department hostage, and we were trapped inside with a trained sniper. And time moved differently in those first hours. Every second stretched into an eternity. We lay on the cold linoleum floor, hands visible, barely breathing. Derek paced back and forth, muttering to himself, occasionally shouting orders at us. Stay down. Don't move. Don't try anything. His voice cracked with every word, fluctuating between rage and desperation. I could see the other hostages. Dr. Stevens, a 60-year-old physician who had worked in this department for 20 years, was pale and shaking. Melissa, a young nurse fresh out of school, was silently crying. Everyone was terrified. Through the windows, I could see movement outside. SWAT team members taking positions behind vehicles, snipers on rooftops, a negotiator with a megaphone trying to establish communication. Derek saw them too. He pressed himself against the wall, keeping his rifle trained on us while maintaining visual cover from outside. He was using textbook military tactics, controlling the space, minimizing his exposure, maintaining hostages as leverage. This wasn't an impulsive act. Even in his fractured state, his training was guiding him. The negotiator's voice came through a speaker Derek had knocked over earlier. Calm, measured, trying to build rapport. They called him by name, asked him what he needed, promised him safety if he surrendered. Derek responded by firing another shot through the window, shattering glass across the floor. The message was clear. He wasn't ready to talk. Not yet. My mind raced. I needed to assess the situation like I would any patient. What were the symptoms? What was the underlying cause? What intervention could help? I watched Derek carefully. His movements were becoming more erratic, his speech more disjointed. He kept wiping his face, his hands shaking worse than before. Something was wrong beyond the obvious psychological crisis, something medical. And then it hit me, a memory from months ago. Derek in my emergency bay, hypoglycemic, exhibiting the exact same signs: excessive sweating, trembling, confusion, aggression. My heart pounded as the realization crystallized. Derek wasn't just having a PTSD episode, he was in a diabetic crisis. I had seen this pattern before. Severe hypoglycemia didn't just cause physical symptoms, it could trigger profound psychological disturbances, aggression, paranoia, irrational behavior. The brain, starved of glucose, begins to malfunction. For someone already battling PTSD and depression, a hypoglycemic episode could be catastrophic. It could transform fear and trauma into violence. Everything I was witnessing, every erratic movement, every nonsensical statement from Derek pointed to one medical reality. His blood sugar was dangerously low, and it was amplifying his psychological crisis tenfold. I needed to confirm my suspicion, but I couldn't just stand up and announce it. One wrong move and someone could die. I watched Derek pace near the supply cabinet. He stumbled slightly, caught himself, then continued. His pupils were dilated. His skin was pale and clammy. Classic signs. I looked at Dr. Stevens, trying to catch his eye. When he finally looked at me, I mouthed 2 words slowly: low sugar. He frowned, confused at first. Then his eyes widened with understanding. He had access to Derek's medical records. He knew his history. Outside, the negotiator continued talking. They were offering food, water, medicine, trying to build trust. Derek ignored them, instead focusing on some invisible threat only he could see. He aimed his rifle at the window, then at us, then back at the window. His movements were becoming less controlled, more desperate. Time was running out. If his blood sugar dropped any lower, he could lose consciousness. Or worse, his impaired judgment could lead him to pull the trigger. I made a decision. A terrifying, possibly fatal decision. I had to try to reach him, not as a hostage, not as a threat, but as his nurse, the person who had cared for him before, who had seen him at his most vulnerable, and treated him with dignity. I had to remind him of that moment, that connection, and I had to do it before his brain shut down completely. I slowly raised my hand, just slightly, testing whether he would react. He spun toward me, rifle aimed directly at my chest. The barrel of that rifle looked like a tunnel to another world. I could see my reflection in the metal. Every muscle in my body screamed to lie back down, to stay silent, to survive by staying invisible. But something deeper pushed me forward. Maybe it was my training, maybe it was intuition, or maybe it was the memory of Derek sitting in that hospital bed months ago, crying because he felt like a failure. That human connection we shared for just a few minutes. I had to reach that part of him again. My voice came out steady, despite the terror coursing through me. Derek. I said his name softly. He blinked, momentarily confused. Derek, it's Lauren. I'm the nurse who helped you before. Remember? You came to the emergency department. You were sick. Your blood sugar was low. I helped you. His rifle wavered slightly. I could see recognition flickering in his eyes, fighting against the fog of confusion and fear. I continued, keeping my tone calm, clinical, but warm, the same tone I used with every patient in crisis. Derek, I think your blood sugar is low again, really low. That's why you're feeling this way. That's why everything seems wrong. Your body needs glucose. I can help you, just like I did before. He stared at me, the rifle still pointed in my direction, but something in his expression shifted. A crack in the wall. I pressed forward. I know you're scared. I know everything feels overwhelming right now, but this isn't you. This is your body betraying you. Let me check. Let me help you, please. The silence that followed felt like hours. Everyone held their breath. Outside, the negotiator had gone quiet, perhaps sensing something changing inside. Derek lowered the rifle slightly, just inches, but it was enough. His voice came out broken, barely a whisper. I don't know what's happening to me. I don't feel right. My heart soared with hope. He was still in there, the real Derek, the man who wanted help, who was drowning in circumstances beyond his control. I nodded slowly. I know, and that's okay. We can fix this. Will you let me check your blood sugar? I have a glucometer right over there in the cabinet. Now I want to hear from you. Where are you watching this story from? Write it in the comments. It's incredible to see people from so many places following stories like this. Derek nodded. A small, almost imperceptible movement, but it was permission. I slowly stood up, keeping my hands visible, moving with deliberate slowness. Every eye in the room was on me. I could feel the weight of their fear, their hope, their prayers. I walked to the supply cabinet, opened it, and retrieved the glucometer and test strips. My hands were shaking, but I forced them steady. I had done this test thousands of times. This was just another patient, just another emergency. Except this patient had a rifle and was seconds away from complete psychological collapse. I approached Derek cautiously. He backed against the wall, keeping the rifle in one hand while extending his other arm toward me. I knelt beside him, speaking softly the entire time. Okay, this is just going to be a small prick. You'll feel a little sting, and then we'll know what's going on. I pricked his finger, placed the blood drop on the test strip, and inserted it into the glucometer. The device beeped, calculating. Those 3 seconds felt like an eternity. Then, the number appeared. 38 milligrams per deciliter. Critically low, dangerously low. Low enough to cause everything we were experiencing. I looked directly into Derek's eyes. Your blood sugar is 38. That's really, really low. That's why you feel confused and scared. That's why nothing makes sense right now. But I can fix this. I can give you glucose, and you'll start feeling better in just a few minutes. Will you let me do that? He stared at the number on the screen, then at me, then back at the number. Something in his expression crumbled. The warrior facade, the aggression, the fear, all of it collapsed. He dropped the rifle. It clattered on the floor with a sound that made everyone flinch. Then he buried his face in his hands and sobbed. I didn't wait for permission. I grabbed an IV kit and a bag of dextrose from the supply cart. Dr. Stevens, sensing the shift, slowly stood and helped me. Together we inserted an IV line into Derek's arm and began administering glucose. Derek didn't resist. He just sat there, crying, repeating the same phrase over and over. I'm sorry. I'm so sorry. I didn't know what I was doing. I held his other hand, the way I had months ago, and told him it was going to be okay. We were going to get through this together. The next 20 minutes were a medical miracle unfolding in real time. As the glucose entered Derek's bloodstream, his brain began to receive the fuel it desperately needed. The confusion started to lift. The aggression melted away. The trembling in his hands began to subside. I watched his pupils return to normal size. His breathing steadied. His speech became clearer. It was like watching someone emerge from underwater, gasping for air, finally able to see the surface. The transformation was profound and heartbreaking. The Derek sitting before me now was not the man who had terrorized us minutes ago. He was a scared, sick veteran who had lost control of his own mind and body. Dr. Stevens checked Derek's blood sugar again, 58 milligrams per deciliter, rising, still low, but improving. We continued the glucose infusion. I stayed next to Derek, talking to him softly, keeping him grounded in reality. Outside, the negotiator must have noticed the change. The tone shifted from crisis management to cautious optimism. They asked if everyone inside was okay. Dr. Stevens carefully approached the window and gave a thumbs up. A collective exhale seemed to ripple through the building. Hope was spreading. Derek looked around the room, finally seeing clearly what he had done. The shattered window, the terrified faces, the rifle on the floor. The reality crashed over him like a wave. He began to hyperventilate. I'm a monster. I almost killed you. I almost killed everyone. Look what I did. I squeezed his hand firmly. No, you're sick. You have an illness that made you lose control. That's not the same as being a monster. Monsters don't cry when they realize they've hurt people. Monsters don't feel remorse. You're human. You're struggling, and we're going to help you. Melissa, the young nurse who had been crying earlier, slowly approached with a blanket. She draped it over Derek's shoulders, a gesture of compassion that nearly broke me. Even after everything he had put us through, she saw a patient in need of comfort. That's who we were as healthcare workers. We treated everyone, regardless of circumstance. Derek looked at her with such gratitude and shame that tears streamed down his face again. I'm sorry. I'm so sorry. She simply nodded and stepped back. The humanity in that moment was overwhelming. With Derek's blood sugar stabilizing and his mental state clearing, the immediate danger had passed. But the situation was far from over. Outside, SWAT teams waited for a signal. They didn't know what we knew. They didn't know this had been a medical emergency amplified by psychological trauma. They saw an armed hostage situation with a trained sniper. Dr. Stevens and I carefully explained to Derek what needed to happen next. He needed to surrender. Peacefully, hands up, no sudden movements. The police would arrest him. There would be consequences, but we would advocate for him. We would testify to what really happened here. Derek agreed. His blood sugar had risen to 72 milligrams per deciliter. Not perfect, but functional. His mind was clear enough to understand the gravity of his actions and the necessity of accountability. He asked to speak to the negotiator. Dr. Stevens handed him the knocked-over speaker. Derek's voice was hoarse but steady. This is Derek Hoffman. I'm surrendering. Nobody is hurt. I'm putting down the weapon. I'm coming out with my hands up. Please don't shoot me. I need help. The negotiator responded with careful instructions. Hands on head. Move slowly. No sudden movements. Officers will secure you. We all stood back as Derek followed the instructions exactly. He placed his hands on his head, interlaced his fingers, and walked toward the door. Dr. Stevens unlocked it. The door swung open, and Derek stepped into the hallway where armed officers immediately moved in, taking him to the ground, handcuffing him, securing the weapon. It was over. The hostages were safe. Derek was in custody. The emergency department erupted in a mix of relief, tears, and exhaustion. Paramedics rushed in to check on everyone. Police began securing the scene and taking statements. I sat down on the floor, legs finally giving out from the adrenaline crash. I had just negotiated with an armed man using nothing but medical knowledge and human connection. I had bet my life on a diagnosis made from observation alone, and somehow, miraculously, it had worked. Melissa sat down next to me, and we held each other without saying a word. There was nothing to say. We had survived something that would change us forever. Something that would replay in our nightmares, but also remind us why we became nurses in the first place. The aftermath of that day was complex and painful. Derek was arrested and charged, but our testimonies, along with medical records and expert witnesses, painted a complete picture. A diabetic veteran with severe PTSD had experienced a life-threatening hypoglycemic episode that triggered a psychotic break. He wasn't a terrorist. He wasn't evil. He was a sick man who lost control of his mind. The court mandated intensive psychiatric treatment, diabetes management education, and years of supervised care. It wasn't a happy ending, but it was a human one, an acknowledgement that mental health and physical health are inseparable, especially for those who have sacrificed so much. I continued working in the emergency department, but something changed in me. I became an advocate for veteran healthcare. I pushed for better integration between medical and psychiatric services. I trained other nurses to recognize the warning signs of hypoglycemia-induced behavioral changes. I shared Derek's story, with his permission, at conferences and in medical journals, not as a tale of heroism, but as a reminder that sometimes the most critical intervention isn't a medication or a procedure. It's paying attention. It's remembering details. It's seeing the human being behind the crisis. Derek and I exchanged a few letters after his sentencing. He was getting the help he needed. His diabetes was finally under control. His PTSD was being treated with trauma-informed therapy. He expressed remorse every single time he wrote, and every single time I wrote back. I reminded him that seeking help and accepting it was the bravest thing he could do. I don't know what his future holds. I don't know if he'll ever fully forgive himself, but I know he's trying, and that matters. Looking back, I realized that everything I experienced that day, all the fear and uncertainty, came down to one simple truth. Details matter. The small things we notice, the connections we make, the moments we choose compassion over protocol. These are the things that save lives. That day could have ended in tragedy. It could have been a news story about a hospital massacre. Instead, it became a story about how medicine and humanity intersected at the most critical moment. How one detail, hiding in plain sight, changed everything. So I want to ask you, have you ever been in a situation where a small detail made all the difference? What would you have done in my place? Leave your thoughts and experiences in the comments. I truly want to know. And if this story moved you, if it made you think differently about healthcare workers or veterans struggling with invisible wounds, please subscribe to this channel. There are so many more stories like this. Real stories from real nurses who face extraordinary circumstances every single day. These stories matter. They remind us of our shared humanity. They show us that heroes don't always wear capes. Sometimes they wear scrubs and carry stethoscopes. Sometimes they save lives not with force, but with knowledge, observation, and compassion. Thank you for listening to my story. Thank you for being here. And please, watch the next recommended video where another nurse reveals a shocking secret about her workplace that will leave you speechless. If you or someone you know is a veteran struggling with PTSD, diabetes, or any health crisis, please reach out for help. You are not alone. You are not a failure. You are human, and there are people who care and want to help you. Stay strong, stay hopeful, and remember that sometimes the smallest detail can save a life.